So we start today's very important and uh, very useful talk, both for the qualified homeopaths and also for the lay people, especially for the parents or relatives of specially abled children. So, the first question that I will only put and take it up is why do we call why the nomenclature specially special children or specially abled children? So, one needs to understand that a mental or a neurodevelopmental disability, unlike other medical problems, which are basically limited to the person who is suffering, only the medical aspect. For example, if you have a heart disease or if you have diabetes, it is predominantly you or the patient who is affected and the patient who gets treated. But here, a neurodevelopmental disorder or a neurodevelopmental disability not only involves, affects the mental health, the physical health of the patient, of the child in this case, but the suffering extends across to the caregivers, to the family, to the extended family, to the teachers who are involved in their education. So, this problem is not just a medical problem, but it is a neuro, psychiatric, social, educational problem. The impact of this is far reaching, not just to the individual, but to the family, to the community in which this child is being nurtured, and in the long term, to the whole of the larger community, larger population as such. So, a lot of judgment happens towards these children. A lot of discrimination happens towards these children because they lack either the intellectual resources, they also lack the social resources. Nevertheless, what is observed is these children have special abilities which the average children of their age may not have. So, let me give you this example that we have seen uh, uh, quite frequently in these challenged children. I remember this child with autism who had this very unusual intellectual uh, ability to guess the number what his mother would think. Mind it, the mother would think a 10 digit number, not communicate to anybody, not even write it anywhere. And then when this child was asked about it, this child would come out and tell you the exact number. There are these very special talents these children have. Some of these children have a very artistic bent of mind also. So they have abilities, they have special abilities which the society will learn, will have to learn to recognize, to integrate in their living, and to respect eventually. And that is why this nomenclature is very important, that these children are integrated, are respected, and become a part of the mainstream society. And that is why they are special children. That's why we call them special children, specially abled also. Remember this. So the perspective that comes here is of societal perception of what is excellence, societal perception of what is able or what is disabled comes to the forefront. How society perceives these children, how we as a part of the society perceive these children becomes very, very important. It will question our beliefs of what is success, what is performance, especially with the current society being highly performance oriented. So one will need to rethink the idea of performance in one's own life too when you encounter these children. Because any kind of bias, any kind of discrimination is only going to worsen the matter rather than integrating these children. So, this is the first understanding that we need as physicians, as people of society, that we need to understand the pathos, the suffering of the children, of the child, and of the parents and of the family largely, and what difficulties uh, they encounter. So, with this background, with this canvas on which we will paint our further talk, I invite questions uh, from all of you at the other end. So, from there, we can take up and talk about various issues surrounding these children. Any questions on Instagram? No questions. So, any questions? One sir. Just okay. So, we'll take up some very common, or rather, very conditions where homeopathy can play a major role towards healing these children. So, the first condition that I will take up here is autism, or what is called as the autism spectrum disorder. So, what are the most important aspects of autism, of an autism spectrum disorder. This disorder was earlier also called as pervasive developmental disorder. So I will start with from that word and then come back here. So when we talk of pervasive developmental disorder, what do we understand by this? First, that it is a developmental problem. There is a problem in the development of the fetus and then of the infant. So therefore developmental. When we talk of pervasive, means it pervades everywhere, every area. A large area of the brain is affected by this disorder. There is no one specific area that you can say that this is the only area which gets affected in the brain of a child with autism. So this terminology has now upgraded to autism spectrum disorder. So clinically, how do we recognize a child with autism? Most of the time, the child is brought to us, brought to a physician, or brought to a pediatrician, and now very often even to a homeopath directly, where the patients, the parents especially, would complain that this child is disobedient. He doesn't listen to what we tell him to do. Whatever requests are made to the child doesn't follow. The second part that we will see in these children, that parents will often complain when they first bring this child to you, is that this child remains in his own world and doesn't interact with other children, doesn't interact with children of his own age, doesn't interact with the family members, the parents. These are the commonest presentation that we will find of these children. The other aspects of this disorder, which is most important, are communication deficits, social communication deficits. So, what do we understand by this social communication? So, first thing you will find is as the child grows in his early months, you will find that the child will give a smile back to you, back to absolutely all people around. This is the first interaction that the child begins to make with the world. The child also will smile back to the parent and giggle, squeak when he sees his mother or she sees its mother. This is called emotional, social, emotional reciprocity. That means you are reciprocating. This reciprocation is a problem with autism spectrum disorder. The other aspect of the same social communication deficit is the ability to form and maintain social relationships. So, therefore, these children will not be able to bond with the other children. Now, let us understand this very complex problem. When one talks about forming a relationship, there is a reciprocal interaction, then a bond forms. In this child with an autism spectrum disorder, this aspect, the social development is compromised at this level, and the communication, social communication, is compromised. Therefore, the developmental disorder, this is a developmental disorder. This aspect of development is primarily compromised in a child with autism spectrum. The other part that comes up, yes, also in social communication deficits, you also find that the non-verbal communication is also compromised many times. The next very important part of this is having repetitive or restrictive behavior. So, very often you find children with these problems. They will either clap, they will either flap their hands, they will do some task repetitively which really has no meaning. This becomes very, very important where the restriction and repetitive behavior. So, what we find is these children are kind of in a cocoon. They are not able to go out into the world and connect with the world. So, repetitive movement, sometimes they have repetitive speech that they will repeat. These children will also have or may have uh, a set fixed routine which they do not appreciate when it is changed. For example, you will find a child who wants to eat a particular kind of food. So, for months together, this child will only eat this food and not eat anything else. In fact, is averse to anything else. So, this is the second very important point where there is ritualism, there is routinism, and the other aspect, which is very, very important within this restrictive problem, is a sensory, either oversensitiveness or undersensitiveness to sensory stimuli. So, what are the sensory stimuli that we are talking about? We are talking about touch, we are talking about light, we are talking about sound, we are talking about taste, we are also talking about gravity. Gravity is also a very important sensation that we all experience, but we are not aware about it. What is called as proprioception. So you will very often find that these children cannot tolerate even a sharp noise. If there is a whistle that is blown, they will shut their ears. If the mixie in the house goes, they will shut their ears. They call it auditory closure because they cannot tolerate this kind of noise. You will also find some children having tremendous amount of gravitational fear. Going down is a huge problem for these children. So in and many times it's the taste. They cannot, even the texture, the touch. So a lot of children may not want to be touched. They will absolutely be averse to being hugged, even by their own family members. So touch. Or you will also find that they are undersensitive. Means very often you will find that if the child is hurt, the child doesn't realize even if the wound is bleeding. So these are the sensory, in technical terms, this is called sensory disintegration. This is also a very important aspect of autism spectrum, and it also shapes up how the whole child is behaving in the world outside. So this is as far as how you understand what are the first aspects of autism. And there is one question. It said parents often don't comply. It makes treatment difficult. How do you deal with this? Yes. So the biggest challenge for the physician and for society as such, I would say, not just the physician, but as to the society as such, is denial. For very long and very often, the parents are in denial of a problem with their child. This is the biggest stumbling block. Very early, parents are, when the child is very young and they have taken him for a routine examination, this disability or this dysfunction is picked up by the primary physician, and also it is presented and talked about with to the parents. But we have often encountered that parents deny that that child has a problem that needs to be treated. This is the most difficult part. The second part, so therefore, what is very important is talking to the parents, understanding their perspective, what are their beliefs, and to drive this point home that there is a problem with this child and one needs to work with this child. Once this is taken care of, things at least begin to move. The other side of the difficulties that we encountered is that various therapies, and here when I talk of homeopathy, that is medicine, along with occupational therapy, speech therapy sometimes uh, behavioral therapy hmm, is required for these children. So a multidisciplinary work has to be done for this child to bring any order in the system. And this imposes a huge amount of financial burden. on the parents. So there has been a lot of government support that is available to these children, and these schemes need to be spoken about. The parents need to be educated about this, and a lot of advantage can be taken from this. The other part is to make all these things available in one space. So that makes treatment compliance much better. And making the treatment affordable is another way to deal with this problem. Then, what is very another very important point is early intervention. The more faster you intervene in these children, the more better is the outcome, whether it is homeopathy, whether it is occupational therapy, whether it is speech therapy, whatever. So early intervention is the key thing. And the biggest problem for early intervention is societal, familial, parental denial. And it prevents the child from getting help at the earliest. Then I have the second question, how medicines can help to cure it, by Pallavi Kansara. So I will not talk about cure, but I will tell what homeopathy can help, how homeopathy can help, along with occupational therapy and along with, if required, speech therapy, also applied behavioral analysis. What we have found with homeopathy is that when we look at the important aspects of autism is the communication, the social communication, making eye contact is the first communication. Res- Reciprocating to a call, to an emotion from the parent is first achieved in children when they are put on homeopathy. This is the first important and the quickest response that we find in these children. As the treatment progresses, we find this routinic behavior, routine, the tight routine, repeatedly doing things begins to improve. And what we spoke about, this too much sensitivity to a sensory experience or too little or under sensitivity to a sensory experience begins to improve. Moment these two aspects begin to improve, the child begins to start connecting with the world outside. So, this process takes can take several months depending on the severity of the disease. So, I will not be able to tell you that after taking the medicines within 2 months or 3 months or 2 weeks, this problem will start improving. It is very different from case to case. So I've had children who showed very little improvement for the first 6 months, and then the improvement really goes up fast. And I've also had children who have shown response within the first 2 weeks. So a lot of variation. That's why I understand the word spectrum. It is autism spectrum disorder. What is spectrum? That means there is a whole range of issues that are that come along with this neurodevelopmental disability or disorder. Depending on what comes together, the response of the treatment will be. But the key thing is early intervention, which is extremely important, and not to lose out time. So, what we normally do at our clinic is to do a assessment of the autism when the child is first brought to us. How do we do the assessment? The assessment is done by the psychologist, clinical psychologist associated with our clinic, and we do a test, what is called as Childhood Autism Rating Scale, or CARS in short. This is a universal gold standard test. It is a standardized test which a qualified, a trained psychologist can carry out, and we can exactly find out what is the level of autism, and in the spectrum of all these disorder, what are the areas of problem for a particular child. And our experience has shown that year on year, the CAR score, so in CARS, they will give you a score. Higher the score, higher is the severity of the autism. And as treatment progresses, we have seen the score going really low, and several children we have documented to have gone out of the autism spectrum, uh, the diagnostic criteria of the autism spectrum. I do not definitely want to say that this is a cure of this problem. No. But they are the clinical documentation definitely tells us that the score on the autism scale has been normalized. And these children have also been integrated into mainstream school. But this does not happen with all children. Please note this. Especially if, along with autism spectrum, if there is a medical comorbidity or another problem, maybe a genetic disorder, metabolic disorder, or a genetic enzyme deficiency, or epilepsy, or many other neurodevelopmental problems are coupled with this disease. In this situation, things are going to move much more slowly. What we have also found, that children who are purely on homeopathy, they will improve to a level, and then the rate of the rate at which the improvement happens slows down a lot until an occupational therapy is added or a ABA is added. And also the other way around, because a lot of children come to us who have already been taking occupational therapy, who have already taken ABA, who have also taken within occupational therapy, sensory integration therapy. They have improved to a certain level, but now the improvement plateaus. And here, where homeopathy intervention happens, you have the next level of improvement. So both these aspects need to be coupled. So we also always say that we need a multidisciplinary approach towards these children to heal them. Any one approach is insufficient. I hope, Pallavi Kansara, this answers your question. Any other questions? Okay. So I want to talk about another aspect which is very central to a lot of neurodevelopmental problem. And in fact, uh, okay, so there is a question that comes from Instagram. How long will a homeopathic treatment last? So again, there are no standard fixed regimes that this is the treatment. Once this is done, it is over. Normally, children follow up with us anywhere between 2.5 years to 7 years, where we have seen these children actually as small infants and now they have become children, and some of them are also mainstream. So how long the treatment will last will depend upon a very individual case, but I would say that it has to be a long term treatment, long term management that is required for these children. And it is certainly not something like 3 months or 4 months or 5 months. So I hope that clarifies, because as things change in the disease, one also needs to make changes in the dosage, in the medicines of these children. I hope that answers the question. Right. So I was coming to another very important aspect, which is only recently being recognized as a disease in itself, what I call as a sensory processing disorder. It is not this. What is this problem? So when we talk of neurodevelopmental problem, we normally, when we child is born, we look at the motor development of the child, sitting, standing, holding things. Then we look at the development of speech. The third, we look at the development, what is called as social development. How child interacts, how child smiles, hmm, the moods of the child. We normally look at three things after the child is born. But before the child is born, there is a very, very important system which is important for survival, is the sensory system. The whole sensory system largely is developed in the fetus. And when you are out, this sensory system is ready to receive the stimulus from the world. So, in this situation where there is a sensory or disintegration, or the processing of the sensation becomes a problem, then you have lot of other issues that come up. So what are the senses that we are talking about? I will repeat once again: visual or vision, smell, taste, touch, temperature, pain, vestibular or gravitational. Sorry, I happen to say gravitational as proprioception, but it is the vestibular system, and then the proprioception. These are the sensory systems, the sensations that our brain has to deal with it. If the brain cannot process these variety of stimuli coming from many sources, then the first most important problem that happens is inability to coordinate, inability to pay attention, and inability to learn. So, coordination, attention, and cognition. Once you cannot do this, then you cannot perform anything outside. Your performance is disrupted. So, this sensory processing abnormality is common to many neurodevelopmental disorders. And very recently, this itself is being called as an entity on itself. But still, the scientists are deciding upon it. So, in what kind of problems do we see this? I mentioned in autism, I mentioned in ADHD, what we know classically, attention deficit hyperactivity disorder. Also in what we know, dyslexia, or now what is called as learning disability. Hmm. So this sensory processing abnormality is the problem with the development of the sensory system. Once there is a problem in receiving the stimulus, then your muscles also don't understand where the position of the joint is. Your nervous system doesn't understand. If you are not able to understand the touch, you cannot discriminate the touch, then a lot of problems arise in understanding and formation of the self. When I'm talking about the self, I'm talking about the psychological sense of who I am. That becomes a problem. And when the brain is affected, the brain, the central nervous system, and the nervous system per se are deeply integrated with our immune system. So, any abnormality in the central nervous system, autonomic nervous system, has direct impact on immune response, on the endocrine system, on the immune response. That makes the physical health also at risk for various diseases in future of this child. Another very important aspect that happens in this abnormality is because the muscles don't understand, the brain doesn't understand what it is receiving. I told you there are problems with attention, problems with coordination, problems in learning, and eventually problems in self-worth, and large amount of behavioral problems. Relationship with society is also compromised. And here, homeopathy can be of big help. We have seen how it helps sensory integration to take place. A semblance to come in this child once they are put on homeopathy. So, a lot of these disorders, typically, classically, I will say autism, ADHD, and learning disabilities, when the sensory disintegration improves, we are able to see a marked improvement, especially in the behavioral aspect of this child. Yes, so Saurabh Patel has asked what to teach or train the parents. So, largely, what is important, it will be first is getting out an acceptance of the condition, that you need to accept that there is a problem and you need to work with this problem in a multidisciplinary way. Then I would work in coordination with our psychologist at the clinic, and a lot of these children may require what is called as applied behavioral analysis. Depending upon, again, we are talking about autism spectrum, what is the requirement of that child, the therapy is designed accordingly. And also, so the parents need to be taught that, and I will leave it to the psychologist to decide on the therapy in terms of what the parents need to do when you deal with the child. Also, the other aspect is the education aspect. So, remedial education becomes very important when it comes to children with ADHD, learning disabilities, and even children who are slow learners. Here, a remedial teacher can play a very vital role. In fact, remedial education becomes very central. Even in children with autism, once they have improved, special education becomes extremely important. Special education or remedial education will deal with various aspects of learning. It is not just the book learning that we are talking about. We are talking about life skills, we are talking about social skills, and of course, we are talking about our cognitive learning and the formal learning that we are talking about. Again, this is a field of expertise, and I would refer our children at the clinic to a remedial educator who chalks out a program for them, and it needs to be followed. Now, very often, even schools have got remedial teachers and remedial classes for these children, which can be of very big help. So I hope, Saurabh Patel, this answers your question. Okay, so if there are any more questions, I will take it up, or we end our session for today. We come back again next month with another topic. Here we talked about predominantly autism. We will talk about other developmental disorders and what homeopathy can do in our next session. Homeopathy has a very large role to play in healing these children at various levels. So, if any questions, please put up your question in the chat, even on Instagram. Do we have any questions on the Instagram? Okay. Any program for homeopaths to learn how to treat child psychiatry? Now, I believe that now there is MD psychiatry that is been happening, and I'm sure it would be a wonderful area to work with. Personally, I was trained in our days, there was no MD psychiatry, but I was trained personally for several years under Dr. Praful Barwalia and his organization Spandan at Bombay, and had the opportunity to even start a Spandan clinic here in Ahmedabad for these special children for several years. So a training certainly is needed in neurodevelopmental problem, pediatric psychiatry, and one should not lose the opportunity. In fact, it is uh, one of the uh, very fruitful areas to work with. So you will have to explore what are the recent programs, but MD psychiatry is certainly one of the areas that need to be explored if you really want to take up this as your post graduation. So it is a rigorous study, and it's a very highly specialized study that one needs to take up. Okay. So thank you so much. We end this program here, and we will come back again next month with something more interesting on the same lines. Goodbye. End it now.